Photobiomodulation. You need to know it. How does it lower pain signals from a cellular level? What can you expect from different pain patterns? Who's a good fit and what do you need to look out for? What dosing actually works and how can we maximize those results? Have you heard of the new dual channel strategy? And what if you could have a repeatable chronic pain protocol for your clinic? Great news, you can. Get ready to learn all of this and more on today's Pain Masterclass. Hi, I'm Dr. Mark T. Wade, founder of the American Posture Institute and your co-host on the Pain Summit. The purpose of the Pain Summit is to provide healthcare professionals like you with proven solutions to help your patients overcome chronic pain. I'm honored to welcome our next guest expert on the Pain Summit, Jeff McKeever. Jeff is the legendary California branch manager for LightMD and co-owner of UltraRed Light in Newport Beach. He trains clinicians and home users on LightMD Mark II photobiomodulation systems, focusing on safety, dosing, and outcomes. His work centers on practical protocols that reduce pain, calm inflammation, and accelerate recovery. And today, he will be sharing with us the LightMD Mark II live demo, practical photobiomodulation dosing strategies for chronic pain. Jeff, thank you for joining us as a speaker on the Pain Summit. Please take it away.
Dr. Mark, thank you for having me today on the American Spine Institute Pain Summit. I am very excited to share with you all what we have here with LightMD, an advanced phototherapy system unlike anything you've seen. Now, I'm going to be talking about practical dosing strategies as well as how we get to deep chronic pain, long-lasting results. And I have with me here an opportunity to really give you an insight in how this system differs from all the other stuff on the market. Now, I come to you in a unique position where I not only get a chance to treat people daily at my clinic, also representing the technology, but I've had my own experience being a former D1 athlete and understanding that there are other modalities out there that can really reduce the pain and the pain signals within the body, giving you an opportunity to heal naturally. Now, sometimes you may need surgery, sometimes you may need some other opportunities to understand how you can improve those tissues or systems of the body that aren't functioning correctly. But I'm going to bring to you this medical grade PBM system by LightMD. So we all know that on the market right now, there's a lot of red light therapy devices out there. But what LightMD does differently is we have a true grade photobiomodulation system. Now, what photobiomodulation is these days is a therapeutic application of non-ionizing electromagnetic radiation in the near infrared and visible light spectrum applied to living cells to invoke that metabolic and gene expression mechanisms combating the disease and injury and pain. Now, with our system, you can see we have a long list of certificates. And from these certificates, we've had 26 years to have a lot of R&D research, publicized papers, and really giving our patients and our practitioners an opportunity to have something that's going to be long-lasting, repeatable, and giving you the confidence to know that this is a medical grade system. So as you can see here, we have a lot of different certificates, FDA approval here in the US, 510K approved. We've been through medical trials and we can prove our efficacy through that. So I want to go through just a real quick credentials of LightMD and this Mark II system. Okay, now we have a system that is unlike anything else. And one of the reasons that we can have very much confidence in telling you all about this is because we have our own operating system that over the years, we have developed these programs which now have turned into new recipes for us. And I will go into that in a little bit later. But as you can see, we have a very small tabletop system, portable, accessible within any type of condition, whether you're in a hospital or you're in a clinic setting. It doesn't take up a lot of room, and it allows you to have multiple patients on a dual system channel This gives your patients and yourself a chance to treat at a dual channel aspect. So we have these LightMD pads that are also patented. So we work through a multitude of wavelengths, but today I'm going to be focusing on the red and near infrared aspect to do the mitochondrial activation and get that cellular repair and energy that we are looking for when addressing chronic pain. So you can see here that we have 2 sets of pads. Independently, each channel can operate up to 3 pads. It also gives us the opportunity to extend these pads and show coverage of the body, which I'll get into in a little bit later. These configurations also give us the ability to bend the pads and have the flexibility to configure around body parts. And that really gives us the ability to get deep into tissues and have that penetration we are looking for. So with a large concurrent treatment area, we have up to 6 pads, which gives us a 1,200 centimeters squared opportunity to cover large visceral organs like the lungs, which is something that we don't see often in other types of publications, as they might be using a spot treatment of a laser or a handheld device when we get into this. So I just want you to be aware that we have gone through rigorous testing to make sure that our software and hardware is safe and efficacious. We also have patents, and these patents protect us. And this is why you're not going to see anything else like this on the market. So just to give you a full understanding of what LightMD offers in these wavelengths is knowing that red and near-infrared light is going to give us that mitochondrial activation, the cytochrome C oxidase activation, and generating that ATP, which our body is going to need to put us into that healing state and get the results that we are looking for, which are going to be repeatable. These are not things that are just one-off that you're going to be looking for. How am I going to continue to repeat this for my next patient? These are everyday results that I see in my clinic. And from that, I want to go over some of those protocols, but we also have the ability to work with other wavelengths. So specifically the green and the blue and the violet are other things that we offer. And each of these wavelength pads also come with the near infrared setting. So we're always going to be able to get deeper into the tissues using the near infrared. So when we're talking about chronic pain, there are a lot of different areas in the body that chronic pain can sit into, or just pain itself. It can be from infection, immune response, even everyday injury. We know that inflammation is a big part of this response. So when we have this system, we have the ability to do all sorts of things to help the body heal naturally. And one of those is going to be improving circulation and tissue oxygenation, but really generating that ATP gives our body a chance to really get down to the root cause of what's giving all these symptoms in our body, or as a whole, not allowing our body to function properly. So using this system to combat muscle spasm, cramp, soreness, those are everyday things, but really getting down into the ability to use this for chronic pain, we're going to take a dual system approach. And what I mean by that is we're going to be addressing systemic as well as systems of the body for looking, So with the therapeutic benefits of LightMD, we're able to use a dual channel aspect and really addressing not only the systemic pain and the root cause, but also treating the site specific. So through LightMD, we have the ability to even get deep into the brain and have transcranial treatment, which is unlike any other system you might see on the market. So going through some of the advantages and why we are able to get down into this deep tissue penetration. You can see here with the energy coupling that we have, I'm going to show you really quick. We have these pads, as I talked about, that are medical grade. So using these pads here and placing them directly down the core of the body, I am able to address the vagus nerve and calming and relaxing the systems to get ready to be into that place of healing. So utilizing these pads, which are bendable and flexible, I can cover a large surface area, getting down into that deep tissue penetration. And with our extensive portfolio of having programs as well as recipes, which we call sessions, we are going through a multitude of pulsed frequencies, and utilizing our frequencies, they are very tissue specific. So right here, I'm showing that I can be placing the pads directly on the core of my body, treating the thymus, solar plexus into the gut. And this is very important when trying to put somebody into a rest and restore place. So we want to make sure that our pads are large enough to cover these areas of the body to address the system that might be responsible for what is causing the root, which might be responsible for the symptoms that are causing the pain in the individual. So we also have another pad placement of a neck collar. This is also going to show you that we can get into those glands like a thyroid or treat neck pain here. But what's really great about this understanding of our neck pad is it doubles and works to treat transcranially over the brain here. We also get into the brain from underneath the jowls here. So we have a lot of flexibility, not literally in the pads themselves, but also with pad placements that we can place on the body, giving us a range of places that we can treat and make these long-lasting effects on our patients and clients to give them what we know is the right therapeutic dose. And a lot of people out there are trying to figure out, how do we get that therapeutic dose correct? Well, it really comes down to delivering the right wavelengths. And we know with the red and near infrared light, we're going to be utilizing those wavelengths to address every tissue, to get deep into those tissues for long-lasting results. And when we get down there, it just doesn't happen. People just think, oh, I can just shine red light and it's going to get down to all the way down to the tendon or the ligament. Well, that's not necessarily true. And by having the depth penetration that we can actually prove through our efficacy in our trials and published papers that we've shown, we know that we're invoking a full PBM effect. And that is not true to all systems on the market. And that's why LightMD is very unique. Giving us the ability to sequence multiple wavelengths as well, using the red and the near infrared, or blue, for example, in near infrared, we're able to get a response without the overheating. And a lot of people out there are familiar with using a device that might look a little bit different, and they're trying to figure out, how far away do I stand from it? Am I getting the right amount of energy? Is this making an effect, a long-lasting effect on the tissue? And the answer is, we don't know, because they might get mixed results, where our results with LightMD are constant. They're always going to be changing for what the patient or client needs. And through that, we have seen long-lasting results, which I run myself out of business quite often, because I'm getting people back to a place where their quality of life has improved, the chronic pain symptoms have minimized or completely gone away, and they're able to use this in a fashion of a little bit of maintenance and keeping their body at a place where they're happy and enjoying life. And that really comes down to delivering the right energy dose. So we do know that photobiomodulation is biphasic. So too much or too little energy is not going to make a big difference on the efficacy. I'm sorry, excuse me. So we do know delivering the right energy dose is very important with photobiomodulation. In photobiomodulation therapy, it is biphasic. Therefore, too much or too little energy is going to reduce your efficacy and not get the results that you're looking for. So we have designed this system where everything internal already has what we need in the hardware and software. So it's a one-touch button. You're placing the pads directly on the patient or client of yours, and they are just relaxing and enjoying the treatment. It feels very warm and comfortable. Although the pads themselves are not emitting heat, the body is responding and getting the ability to make the changes in the environment it needs. So, like I was talking about, delivering the power uniformity to treat tissues and organ is very important to be able to drive the energy deep into those tissues where we don't know that other systems are capable of doing this. And what we've seen is there is a lot of systems that are using red light therapy, but they might be too far away from the body. And that reflection and refraction is not giving the tissues a chance to actually absorb the energy that we need to have that metabolic change and that photochemical response to create the ATP. So, excuse me. So the need to control the exposure and brightness and uniformity in time, we've already got that set. We've got 26 years of experience doing this. And like I said, our results are consistent, whether you're in the pain management field, whether you're in neurology, whether you're an orthopedic surgeon looking for that extra boost in post-surgery op and how to get your patients feeling better with not having to take the meds or get into that place of non-movement and really making things stuck, where it's going to be harder for them to recover. So we don't want things to get into a chronic pain place. By addressing the symptoms right out the bat, getting the systems to communicate together, and then also through our pulsed modulating frequencies, we have the ability to really get down into the tissues where most are not even getting past the water or the muscle or even into the blood. So we know through our frequencies that we can resonate with certain tissue types. And that is very important because every tissue type in the body is going to have a different, every tissue type in the body is going to have a different density. And that density is going to play a huge role in how it is affected by the frequency itself. So LightMD has a very unique system as well, because we have the ability to customize LightMD has a very unique system because we're able to customize our frequencies. We have a customized button, so showing that you can put in something like 40 hertz, for example, and treat transcranially and help with memory and cognitive function. We have seen this time and time again with some of our clients that have Alzheimer's, dementia, Parkinson's. We are able to change their quality of life, improve things like memory, even balance. And as you can see here, I'm showing you all of these different types of pad placements on the body that can conform to the body. There is a unique thing when it comes to treating musculoskeletal issues. How do I get these pads, or how do I get this light into the body? Well, what you can see here is that we have the ability to place the pads directly over a joint like an ankle that's really small, but our pads can form. So we can actually put them around that joint and secure them, but not too tight, but enough where the energy is actually coupling and being absorbed at a right angle into the tissues, giving our body what it needs to transfer this light energy into ATP. So I just want to give you short examples here where in the middle of the screen, you can see that we actually have the pads over the eyes. And what's very unique about this is that we are ISO and IEC certified, giving us an advantage to be able to treat over the eyes. And for most people that use red light therapy, they're in these saunas or maybe these paneled light systems, and they have glasses on, and they aren't familiar with, maybe those lights aren't safe. But with LightMD, we have medical grade LEDs, and this is allowing us to not have too much fluence to impact the tissue for a burn or something like that. But we give ourselves the really uniqueness to treat over the eyes, get transcranial treatment into the brain, and make a large impact on the oxygenation and allowing those tissues to get to a place of healing. So you can see that LightMD has a versatile understanding of how to treat the body, giving what we need for not only whole organ, but systemic response and musculoskeletal. So actually, I do want to mention in the middle on the bottom here, this picture showing that we're doing the back of the brain stem and the ears and down the spine is one of our major dual channel output kind of pad placements. And why I'm touching on this is because when people are in this place of fight or flight and they're in chronic pain, they're not able to really calm down the parasympathetic nervous system. This pad placement here allows us to address the vagus nerve and the central nervous system, giving a response to the body to rest, to get to that place where we can actually make an impact on the tissues that we're trying to alleviate the inflammation from, reduce the pain. We can also increase tissue strength. And by reducing inflammation, we are really giving the body what it needs to recenter and give the body, I am showing here with LightMD that we have a ton of evidence through 26 years of monitoring and going through clinician case studies and understanding how we can continue to make these repeatable chronic pain impacts on individuals. As you can see here, we also treat large animals in the equine field of horses, pets and dogs, cats, but we are hospital grade. So you can see that we have a long list of case studies, research, and other testimonies from patients that have really benefited from our tissue penetration, as well as understanding that the only reason we were getting these results is because we were able to get into the brain and slow down the systems to work together and help each other out. So with our Mark II Pro models, we have a lot of options. And I just wanted to give you a short glimpse into what some of our options are, because when treating chronic pain, it is about treating the systems. And it's not just the localized pain, but having the ability to really make an impact on the central nervous system, the peripheral nervous system. And with our MedPro models, we already have these recipes designed in a 4-category area. So we do have visceral organ, central nervous system, peripheral nervous system, and then we have the repair and regeneration side of it. So this gives us a full understanding of the body and what we can do to make sure that the pads and the systems are addressed correctly. And these recipes, they've already been developed. They've already had research done on them. So we continue to get the results that we are looking for. And we have, as you can see, over 120 options through that process. So this is just one case study I wanted to share with you. It was a very complex case with a 24-year-old who was a professional athlete. And she came to us having all sorts of ailments and conditions that she was unable to address in the Western world of medicine. And through that, you can see a long list of things from the non-specific low back pain to the anxiety and the stress. Her hormones were all over the place, dysbiosis, dealing with Crohn's, endometriosis, and even just coming to our office and doing 40-minute treatments, we were able to make a large impact in just 2 to 3 weeks with her, giving her doctors an understanding that the symptoms were being reduced and she was going to start to tritate off of medication. So from this, she ended up purchasing a system to manage her pain and the dysbiosis within her body. But just after 5 months of doing the therapy, she was actually regulated and had clean blood work, the Crohn's and the mental health issues she was dealing with. Just after 5 months of using the UltraRed Light therapy with LightMD, she was able to not have any pain, regulate her hormones, and be at a place where her Crohn's and mental health were completely changed and was on no more meds. So there is the ability to continue to make these results happen repeatedly with any type of condition that these individuals may be dealing with. So just want to give you an understanding, chronic pain is addressed with LightMD, and we want to make sure that you understand there are a lot of options for you in the clinical setting, and it's very easy to use. It's a very simple touchscreen. Your staff can operate this system. We already have predetermined recipes, and chronic pain is what we do. So jump into understanding a little bit more of photobiomodulation by LightMD, and because we are here to help you, to serve you and your patients, and to really get down to the core root cause of what is giving your patients these symptoms so that we can address them systemically as well as locally. And if anybody has any questions, of course, I'd be happy to follow up with an email giving you more research and studies on what LightMD has done over the last 26 years and being able to support you and your clinicians really diving into what red light therapy can do, but especially photobiomodulation therapy by LightMD. Thank you, Dr. Wade.
What an excellent session. Let's do a quick recap of that. So in this session, we covered medical grade PBM systems, insights on how this differs from other options. Jeff's background as a former D1 athlete, clinician, and technician of the LightMD sessions with PBM therapeutic applications of non-ionizing electromagnetic radiation in near infrared and visible light spectrums. We talked about long-lasting and repeatable systems, many approving certifications that back this. We went through the Mark II Pro system features, how it has its own operating system to create specific protocols. It's a tabletop system, portable, accessible in any setting, can have multiple patients at the same time. It's got a patented LightMD pads. There's 2 sets of pads that we were displaying here, but each channel can have up to 3 pads. Ability to bend these pads and flexibility to get into those hard to reach body parts. Can have up to 6 pads covering large areas and organs like the lungs. It's gone through rigorous testing. It's safe. It's patented. These light pads offer a full spectrum of wavelengths. They generate ATP, which our body needs to put into the healing state, not just one off. It's repeatable. It can work on multiple wavelengths. We got blue, we got green, we got violet. It comes with near infrared. Applications. This works for pain, immune, spasm, stress, endurance, stiffness, flexibility, improves circulation, generates ATP, recovery, and of course, chronic pain. It takes a dual channel approach. It can treat the root cause and site specific, gets deep into the brain, has pads that can hit major areas of the body parts, bendable and flexible, has sessions with different pulse frequencies that are tissue specific and can get into the brain from different areas. We talked about the therapeutic effects, delivering the right wavelengths. It can get a response without overheating. It's long lasting results. It's biphasic. Delivering the right energy dose is very important here. It's already what you need in the software with a one touch button approach. And we talked about how it's not the pads generating the heat, but the body's response to the treatment. If it's too far from the body, the light can reflect and refract. So this is why it's important to be close. Has many diverse applications for a multitude of professions, has pulse modulation frequency, and can get down deep into the tissue. It has customized frequencies. We talk whole organs, systemic, musculoskeletal, and it's versatile. It can improve memory, balance, amongst other different applications. And then great evidence around the deep tissue approach and a multitude of options. We talked about the treating chronic pain is about treating the symptoms, visceral organs, central nervous systems, and more, with over 120 options for treatment. That is what we talked about this session on the Pain Masterclass. I do have some follow-up questions that I'd love to jump in here with. I'm sure our community of healthcare professionals has a lot of thoughts and questions going on in their heads too, and they're probably seeing all the different potential opportunities and ways that they could apply this. So again, if you have questions, reach out to Jeff directly. We have his information here for you as well. He's, as he said, he'd be more than happy to answer those. Now, something that really sparked my attention, as you know, we spend a lot of time at the American Posture Institute, focused on the brain, the neurology side. Our postural neurology program dives deep into the neurology of the posture system. So when you started talking transcranial effects, that definitely piqued up my ears right there. So I think the first question I have is, can you kind of talk us through the transcranial effect? What's the benefits for that, or what is like one of the more kind of common applications that you would use that for?
Great question. So one of the things I see more commonly in my clinic is going to be everyday things like headaches and migraines. And I also have people come in with all sorts of discomfort and pain, a lot of spine issues. And through that, I'm using the transcranial treatment to calm down the nervous system and really reset the balance of what their body needs to get into that healing state. And this is unlike any other approach where people are just seeing the symptoms and they're just going to go address that and attack that, where we're really giving the body a new environment of not having inflammation in the brain or not having the body of systems starting to overreact because it's continually in this fight or flight. So utilizing the pad placement over the brain, using the front brain, we do a lot, as well as doing the brainstem ears, we are able to calm them down, relax and restore. And through this, we do see a lot of people change right before they leave our office. I mean, I have had people come in with exuberating pain at a 10 out of 10, and we're able to change the pain signal. Very simply, within 10 minutes, neuromodulation is happening with our system. So being able to change the pain signal really gets them to understand that something is shifting, something is changing within that time that they're at the office, whether it's for just a quick 20-minute treatment or all the way up to the hour. So transcranial treatments are very important, utilizing the brain to help slow down the pain signals and give the body a place to restore itself. So those are some of the very simple kind of understanding of what we utilize it for in the office. And I see great results. I have a 100% result rate of people dealing with migraines or headaches coming in and leaving.
Thank you for that. I do have a follow-up question here. So when you're using this with patients, and it could be anything from, like we were just talking about, the headaches, the migraines, transcranial use, you gave us a lot of different applications. What's the most common? What's your go-to in your clinic? What's the one you see the most common or most frequently that you're using this therapy with?
Pain. Pain is going to be the big one. I have everyone coming to me for all sorts of pain issues, and they don't have to be musculoskeletal. I have the emotional side of it, right? I have people that have trauma, and I deal with a lot of first responders. So pain can be the biggest crux of getting people back to feeling themselves. And through that pain, we know that inflammation is the crux. Inflammation is settled in any part of the body, whether it's in an organ itself or the tissue being musculoskeletal. And really, LightMD gets deep into those tissues to get through the inflammation response. So we're not skipping over it because that's the body's natural process to protect itself. We're giving the body a chance to get through that process 2 to 3 times faster, which is then going to give them the opportunity to really get down in that deep healing and fast.
I love that. And what better? I mean, we're on the pain summit, so being the go-to for pain is definitely a great thing. Now, obviously, I'm taking this and I'm already thinking like, where am I applying this in my patient flow or in my treatment flow? How do you have this set up in your, let's just say a common or generalized, let's say low back pain patient that's coming in? How do you have this set up? Is this a different area, a different room? Is this before treatment, during treatment? Give us just a generalized so our practitioners can visualize how this could look in their clinic.
Right. So when people come to us, I strictly just focus on red light therapy. So I don't have a large intake room or anything like that. So I put them directly in a private room and I'm going to talk to them and get their understanding of what symptoms they might have or what's causing the pain for them. And giving them an understanding that I got you. We have the ability to work through this pain. So I'm going to be placing the pads in a on a massage table or a chair, very comfortable. And, when people lay on the table and do a treatment, it's like people express a warm hug. It's very comforting. It's very enjoyable. It's relaxing. And from that, it's very simple to start start the process of getting people to a relaxed state so that their next step is to get out of that pain to move into the next physical therapy, occupational therapy, things like that are going to give them. So before or after is mostly becoming from people that do PT or from chiropractor or massage. It could be put in there in any place. So you can come into the clinic and do a treatment before those modalities, or if you're in your own clinic, you could be utilizing this system before you're getting ready to do a new type of treatment or movement specialist of something like that.
Such great information, Jeff. This is why we wanted you here on the Pain Summit with us. Thank you so much for doing this and presenting this information to our community.
Well, thank you so much, Dr. Mark, for having me in the American Posture Institution. Very excited to give everyone an understanding of how photobiomodulation therapy by LightMD can really improve your practice and your patients' outcomes.
Now, as we wrap up another great session on the Pain Summit, I'd like to acknowledge Jeff for his excellent work in pain management. I'd also like to commend you, the dedicated practitioner who's here putting in the effort to learn innovative and life-changing clinical solutions to help your patients overcome chronic pain. I'm Dr. Mark T. Wade, your co-host on the Pain Summit. Click below for on-demand summit access and don't miss the game-changing integrated pain specialist certification created exclusively for healthcare professionals and brought to you by the American Posture Institute. Stay tuned and we'll see you on the next Pain Masterclass.